Today, I'd love to introduce everyone to Dr. Colin Anderson, who is the newest member of the orthopedic oncology team at LCI and Levine Children's and the Musculoskeletal Institute. Thank you so much for joining us today. We have so much that we can learn from you, and we're excited to hear your many interesting projects and surgeries and what jazzes you up.
Thanks for having me, Sue. I'm very glad to be here and talk to everybody today.
We're so excited. We know you've been here for a year now, and so I apologize that we're not doing this sooner, but you've had to get your feet wet and COVID hit, and so now we had a great opportunity to talk to you.
Oh, it's fine. It has been quite the year, and I've had to get used to things at this new institution, but it's been a great year so far, and I'm glad to tell you all about what's going on here.
Could we start by you giving us a little background on your schooling and where you've been before you landed in Charlotte and the development of some of your surgical and scientific expertise?
Sure, I'd be glad to talk about that. I'm originally from Minnesota. I was born and raised in the Twin Cities, and I went to high school, undergraduate college, and medical school there. I went to Carleton College for my undergrad and the University of Minnesota Medical School. I developed an early interest in orthopedics and was able to match into residency at the University of Colorado. And so I spent 5 years out there in Denver. Early on in my intern year, I did a rotation in the pediatric service working with one of the orthopedic oncologists there, Travis Hare, and developed a strong interest in this field early on in my residency. I was thankful to go to fellowship at the University of Florida. I did a 2-year fellowship. My first year was a clinical year, and then followed that with a research year, where I essentially stepped entirely away from clinical practice and spent the entire time in the lab learning about sarcoma biology, as well as three-dimensional culture techniques and new and upcoming preclinical cancer testing technologies.
That's a mouthful. Can you tell us a little bit about the types of sarcoma surgeries that you perform and why you've chosen to be both a sarcoma surgeon and a sarcoma researcher, which is really kind of unusual and really cool?
Well, I think one of the reasons I fell in love with this field is because the surgeries are so complicated, but they also take a lot of creativity. No two patients are the same, and no two patients' tumors are the same. So in order to be an orthopedic oncologist, it takes a great depth of knowledge of human anatomy and reconstructive techniques and how to work around these tumors. Early on, and as I developed an interest for this field in residency and read more of the literature, I learned that while there are amazing things that we can accomplish in some patients, we haven't really been able to cure more patients in many decades. That when we started giving chemotherapy to sarcoma patients, that definitely helped a lot of people with certain types of cancers. But since that time, we haven't been able to move the needle any further in order to save more patients. And so I guess while I was excited to be able to help these patients out in their time of need with complex surgeries, I really want to find ways that we can improve treatment overall. And so my goal and the reason I pursued a career as a clinician scientist is because I was at least hoping by the end of my career we could look back and say, wow, not only did I take care of a number of patients, but we actually found some new treatments and new cures for people that didn't exist before. So that's kind of what drives the scientific side behind me. I was very excited to be able to come to this institution because of what a great team they already have established and the infinite potential I see here. My senior partners, Dr. Niesel and Dr. Pat, are both wonderful surgeons, very, very skilled, leaders, and they're good mentors to me. We have such a wonderful team here at the institution, including the other members of the LCI labs, including Nuri Sturwald in our molecular sequencing core, as well as David Farreau in the immune monitoring core. I think there's great potential for future research collaborations with them in the future. Will Ahrens is also a wonderful pathologist, and our clinical team with our PA Glenna and our nurses Heather and Mackenzie, it's just, I could tell from the beginning once I met everybody that this is a wonderful, wonderful place to be. And I was interested in it because I think I was a good fit here, that I offer a few, well, I do most of the surgeries that Dr. Niesel and Dr. Pat do, with the exception of the spine surgeries that Dr. Pat does. There are a few surgeries that I do that they don't offer here. One in particular is the rotationplasty, which is a certain type of limb salvage surgery. Some people consider it a form of amputation, but I don't like to think of it like that. It essentially involves complex tumors around the knee where it would be otherwise difficult for us to reconstruct it with a large metal prosthesis. You effectively take out the entire knee joint and save the neurovascular structures to the lower extremity, and then rotate the lower extremity around and reattach it to the femur, and the ankle joint functions as a new knee joint. I know it sounds crazy to people that have never heard of it before, but it allows patients really unlimited functional potential in the future. They can once the bone heals, they can do whatever they want with it. And so there are patients that play sports, they sprint on blade prostheses, they skydive, they mountain climb, they wakeboard. You know, the activity, the functional level that people can accomplish with that surgical reconstruction is potentially a lot higher than they would have with an amputation, or even sometimes with a large endoprosthetic reconstruction. So that was a skill set that hasn't been offered here before. So was happy to bring that, and I've actually already done 2 of them in my first year. And then I also, in my fellowship, gained some strong expertise in complex pelvic resection surgeries, and that has been helpful